Yes, I think that you are convinced now what MORA can achieve. Look at the hospital. They did a lot of things, but the decisive problems they didn't find. They didn't find. That was the problem of progesterone, and I'm happy too that we have the seminar we spoke about progesterone, and we have a patient here, and exactly it was the breast, it was ovaries and the uterus, and there was a really high, oh yes, oh thank you. Thank you, that is
Thomas.
wonderful. And yes, and it was just the best patient we couldn't find. We could find, and therefore, and there is a relief. Yes, that there is. I'm convinced that there is no cancer, but we must do something because it was the D5, and D5 it is only one step down. But when we here intervene and we go through all our findings, the cancer is never a local problem. It's always a systemic problem. And here that was the evidence for that. But here, why didn't they determine selenium? Selenium you can determine in the blood. It doesn't cost anything. But the basis of treatment here, cancer treatment, and or when there is a degenerative process, and it is clear there is the myoma, and the breast, and so on, the polycystic ovaries, and so on. And why didn't they check the selenium level? Nothing. 4 or 5 euros, and not more. And it is not the idea of complementary doctors who recommend the selenium. It is everywhere in the world it is accepted, selenium. And when the main detoxification program is glutathione in every cell. And I hope we must go forward, and then I will show you in every mitochondria we have glutathione, and nothing at all. And or the other view is to look at the amino acids. And now we start here with the amino. Arginine. Arginine is a central amino acid against cancer, because here, and arginine in our brain concerning Alzheimer, it is also very, very important, but I will speak about later arginine. But you must regard always, and for the heart you need arginine, because arginine widens the vessels, the arterial vessels, and therefore with heart attacks and heart problems, apply always arginine or test arginine. It is impossible that arginine is in deficiency, and here arginine, here in every mitochondria there must be arginine, because it is a precursor that you know almost all, the precursor from what is arginine. That's it, NO, the gas NO, and we will speak later perhaps. And cysteine, when there is a high deficiency of cysteine, you are sure that there is a high environmental toxin. High methionine and cysteine is always a hint to environmental toxin. And here you have methionine, yeah, and yes, cysteine and methionine. Both are in deficiency. And when they are both in deficiency, you are sure that there is a high environmental burden. And so I know when I tested these two, then I was sure, there must be environmental toxin. And we tested it. We didn't quantify it. That was the next step. And then here, glutamine. We know glutamine you need for the mucous, intestinal mucous membranes. Yeah, that's clear. Mucous membrane. Yes, and she's suffering from candida infestation, and therefore the mucous membranes are inflamed of the intestine, and therefore glutamine is in deficiency. Yeah, it fits together. All the test results, they fit together, and you must find here and glutathione. We know, you see, there glutathione it's not so frequent that it is in deficiency, but when it is in deficiency, there is a very, very, very high burden of intoxications, of environmental toxins. Glutathione, halt, we must do something. And starting from Monday, you have a mortar machine? Yes, the mortar super?
Yes.
Yes, and you must have here the result, and then every second day you carry out program 77 with the environmental toxins. And then DMAE, yes. And there is a little tendency for a little. I will not tell you too much, but here concerning dementia and so on, there is a little tendency because DMAE, dimethylaminoethylene, that is a precursor. Who knows? Wonderful, wonderful. Acetylcholine. And acetylcholine is the center substance of Alzheimer. And here, DMAE, and you must take acetylcholine. You cannot buy or you cannot take because it will be destroyed in the intestinal tract, and therefore you can take DMAE, and that is a precursor of acetylcholine. Acetylcholine, where are the receptors of acetylcholine? You know, in the hippocampus. Hippocampus had a lot of receptors of acetylcholine, and there it is responsible for the transformation from, as I mentioned so often, from the short-term memory to the long-term memory. Lipoic acid. Lipoic acid for the brain too. For the brain too. And you remember in water and in fat tissue, it is working, and Q10, yes, here, Q10 and ALA. Both are in deficiency. Here, without testing, Q10 and it is with their in deficiency. Yes, that's a problem. And that is a really complementary treatment when you consider all these deficiencies. Here, and melatonin, yes, and left, there's a left breast. Breast melatonin, and breast cancer, there is no cancer, or no tendency to breast cancer. But here, melatonin is associated with breast cancer and with milk intolerance. Breast cancer is associated with milk intolerance, And what is her problem? Wheat? Her problem? No, it was milk. It was milk. Now we discussed here these 2 days, we discussed only wheat, yes. And here you have wonderful case that milk and some disturbances of the left breast and milk, they fit together again. And yes, here we have the accumulative, yes. In the future, you start, you start always with the accumulation, that you have an idea on which level it is acting. And here progesterone, 350 deficiency, that is very, very high. And we would be surprised when there was no myoma, when there was no polycystic ovary, when there was no lumps in the breast. We would be surprised by this deficiency. One time in half a year, or 2 times, I don't know, 350. And now you have an explanation for all what's going on with her. And that there is a positive test concerning degeneration, that is clear. That is clear. And here, serotonin. Serotonin, what is serotonin, you know? And once more, the precursor of serotonin is tryptophan. Tryptophan, you know, serotonin, tryptophan. Yes, and here we didn't do the atrioventricular bundle heart conduction system. Why? When we carry out a correlation test, and which is the cause for that, for the irritation of the conduction heart system?
Environment toxin.
Yes, that's it, yes. In 90% of all these cases, the heart conduction system is irritated by environmental toxin. And they are very, very high, I'm convinced, because I feel it. Or when there was Sila-Deco or PCP, and I had to press very high burn. And you see, which property have the, one moment, which property have the environmental toxin? An estrogen property. Therefore, that is perhaps one cause that a tumor can develop when they are so high, the burden. But it is no problem, I stress it again and again, it is no problem with MORA to eliminate here, not the parasites, not the heavy metals, but here the environmental toxins and the viruses and the allergies. I repeat it once again and again. Here, yeah? When you have any question or any critic, you can interrupt me every time. Every time, excuse me. And here. Oh, olfactory, hip joint, that is, every second person had problems with it. We don't consider it. But olfactory bulb, what's it?
Environmental toxin.
Yes, but that is the olfactory nerve, you know, olfactory nerve from the nose to the brain. But when it is positive with her, that means she is exposed the current time to the environmental toxin. And when olfactory bulb doesn't test, then it can be an old or former times and a stressor. But when here olfactory bulb tests, then it is a current burn, a current exposition to environmental toxins. Yes. And here you have nearly all the areas of the brain are affected, and when we carry out the correlation test, you see environmental toxins. When you have, for example, a burden by a virus, or by bacteria, meningococcal, or something like that, that's only in a certain area. And here it is spread over the entire brain. The entire brain. And when the entire brain is affected, then you are sure again environmental toxins. And never it is a virus or a bacteria. So you can differentiate always during your testing what is the cause for this problem. Wonderful, I think so. Limbic system, you know, limbic system, that is the area of our emotions. Our emotions is a limbic system because it consists of 3 parts of the brain. It is a system, it is not a local process, but it is a system. Perhaps I can show you, or tomorrow I can show you the limbic system on a transparency. Medulla und ovaria, oh yes, go on, that's it. And here, carcinomum, D6, never keep it in mind, never, it is cancer. It is cancer, but the direction is there. Must be, because the body, the organism, wants to have the progesterone. And when there is such a deficiency, then you will have carcinomum or D8 or like that. But and we can also correlation test. Nothing to do with the intestines, nothing to do with the lungs, nothing to do with the breast, nothing. And then here milk, ammonium causticum. You can quantify the putrefaction. The putrefaction, it is when it is, the quantification, amplification is more than 1,000. It is not necessary to go on measuring the ammonium causticum, because it is so high. You must take ozovit. And we didn't test Clostridia, but we are sure that Clostridia, Proteus, Pseudomonas, that they test positive. They all belong to the putrefactive flora. Proteus too, and Proteus and Clostridia, these are the most important ones. Yes, and Candida, we didn't quantify too, but when you have the CD, there is written the system intestinal therapy by Cornelissen. And then follow exactly what there is written, exactly. And it is always combined. You cannot eliminate Candida without giving them zinc, without giving them selenium. And because the Candida divorced, they take selenium and zinc, always. Always you have a deficiency when there is a Candida infestation. Don't forget it, selenium and in most cases you have a deficiency of vitamin B. Look here.
Yes.
Look here. Oh, there it is. Yeah. No. Here. All the vitamin B. And vitamin B is the first vitamin which is not resorbed when Candida is present. There is on the mucous membrane by Candida, there is like a plastic film on the mucous membrane. and therefore it is not in the stool, in the feces. When you try to find it in the feces, you may have many failures. You must do it 1 time, 3 times perhaps, and then you find the candida. Because salmonella, where is salmonella? In the feces. In any particle of the stool, you have salmonella. You will find salmonella, but not candida, because it is fixed to the mucous membrane. And then you have the response. Which response? Yes, that vitamin B cannot pass through the mucous membranes. And at first, B12 will be in deficiency. Why? Why? It is such a big molecule. And vitamin C is such a little molecule. And when the professor in our exam was angry with us, and he ordered us to write down the structure of vitamin B12. That is here, I think, here, this surface. So big is vitamin B12, and it cannot be resolved because of the plastic film of candida. Of candida, yes. You can see candida, for example, when it is in the mouth. You see the white lining of candida. And, and yes, that is here. And then lead, cadmium, chromium, nickel. And here I didn't do that with her. When there is nickel, nickel is an IgE, an allergy, and type 4. Yesterday we